วัสดีค่ะ It is my great honor to introduce to you a really great gynecologist and a surgeon, Dr. Kiti Tujinda. Okay, Dr. Kiti Tujinda has been a gynecologist for 15 years and in minimal invasive surgery for vaginal hysterectomy for 8 years.
Yes.
Is that correct?
Yes.
And also performing more than 450 cases of vaginal hysterectomy.
Yes.
That's a lot of up to now, 450 cases, a lot of cases, correct? Yes. His research on scarlet hysterectomy was honored and selected to be presented in the annual Asia Pacific Association of Gynecology in South Korea in 2013.
Right.
Okay, that was a great honor for him as a Thai doctor. And last month, April 2014, he was also selected to be the only Thai doctor to represent his research in Dubai at the International Society of Gynecology Endoscopic Conference.
Right.
Correct?
Yes.
Okay, your interest has been in gynecology and
Yes.
also scarless hysterectomy.
Right.
Explain to maybe to those who do not know what hysterectomy is. What is that?
Hysterectomy is a surgical removal of the uterus, the womb, basically, and it is important because it is the most common gynecologic procedure performed on women. Kun Pop, the most common surgery on women is cesarean section.
Cesarean section.
A surgery to deliver
a baby, correct.
Right. And hysterectomy is the second most common surgery performed on women. So it's quite important and interesting.
So hysterectomy is performed when it's like a case that does not involve cancer, something that has to be removed for certain reasons. The doctor says it has to be removed for the health of the patient.
Right.
Correct?
Over 90% of hysterectomy are done for benign condition.
Benign condition.
Okay, and less than 10% for cancerous problem.
I see.
Right.
Right. So when a doctor says you have to remove your uterus,
Yes.
your fallopian tubes,
Yes.
things like that, there are 3 different ways exactly to perform that surgery, correct?
Right.
One of it is more invasive, that is like cutting through like almost like a C-section in the stomach,
Right.
correct? And that's more invasive,
Right.
longer recovery time,
Right.
the abdominal
Right.
surgery.
Right.
The second one is
Second one is laparoscopic surgery.
Laparoscopic
which,
surgery,
is called a keyhole surgery.
keyhole, putting like
Which
very
basically
small
with
incision.
hysterectomy you have like 3 or 4 small incision on your abdomen, and with advanced instruments. And hysterectomy was done through that way.
Right.
And lastly, vaginal hysterectomy. The uterus, the total uterus was removed through the vagina without additional abdominal incision at all.
Okay, so the last one, vagina hysterectomy,
Yes.
that is the one your specialty is in.
Right.
And you are actually maybe the first Thai doctor to be doing the advanced
Yes.
surgery in this field. Is this surgery that you say through the vagina, rather than through the abdominal
Right.
or to the keyhole incision? This third one, this is probably the most safest?
Yes.
Is that the most safest way to do hysterectomy for a female?
Let me tell you, according to the largest studies, is a randomized control trial study. The largest one. It includes over 34 randomized control trial study and over 4,400 patients included, published in 2009. And it's considered to be the most reliable study in medical field.
Right.
And they compare abdominal hysterectomy to laparoscopic hysterectomy and with vaginal hysterectomy. When compared to a vaginal hysterectomy to abdominal hysterectomy, vaginal hysterectomy is better in terms of speedier return to normal activities.
Because there's less surgery involved.
Right?
There's less incision that you have to do.
Right.
There's no surgery actually, you're just going through the vaginal walls.
Right.
Okay.
And no additional abdominal incision. And also shorter hospital stay. The patients stay in a hospital shorter.
Well, how's that, like maybe 1 or 2
Usually
days?
1 or 2 days.
And if it was for abdominal surgery, that would
It
take longer?
like 3 or 4 days.
3 or 4 days.
Yes.
But of course
And-
there's also that scarring involved, so that would take longer to recover,
Right.
right? Okay.
And the recovery period is longer for abdominal hysterectomy.
Okay.
And also less infection for vaginal hysterectomy when compared to abdominal hysterectomy.
Okay.
And when laparoscopic hysterectomy compared to vaginal hysterectomy, vaginal hysterectomy is better in terms of less blood loss and also shorter operation times. This is from the evidence from the largest study in medical field.
Medical
Right.
field that was in
Right.
the United States, correct?
And also, yes, I would. The American Congress of Obstetricians and Gynecologists Committee opinion just published in 2011 on choosing the route of hysterectomy in benign disease. It's clear that the college, the Congress, the American Congress stated clearly that vaginal hysterectomy is associated with better outcomes and less complications. So it means, so I will answer you that it is the safest way to remove the uterus.
Okay, it's the safest way to remove the uterus.
Evidently.
Okay, and it's also less recovery time for the patient.
Yes?
Yes, and it is something that there's less scarring. There's actually no scarring involved.
Right.
Correct?
Yes.
So, Dr. Gitti, you've been doing this surgery, the vaginal hysterectomy, for 8 years.
For 8 years.
For 8 years now, and you actually been trained where this all started in Germany.
Right.
Correct?
Yeah.
And this was
Back-
started many years ago. And before, not many doctors have performed this. Why is that?
In my opinion, it's a matter of training and experience. And at first, I would say it's not easy.
It's not easy.
It's not easy at first. But when you master your skill
Okay.
and experience, when you break through that difficult situation, and you find it much
Okay,
easier.
Maybe we need to describe to those who are prone to be patients or maybe have friends or mothers, daughters, or those who are actually going through this kind of procedure. Why is this harder for a doctor? You're going through the vagina
Yeah,
inside.
yeah.
It's deep.
Yes,
It's
because
deeper, it's
narrow
hard, it's
and
narrow.
it's deep.
Uh-huh.
But with the proper techniques, some special instruments,
Yes.
and skill sets, and training and patience, basically you can do it.
You can do it, but it does take more patience. It also takes a little bit more training than saying doing a abdominal surgery. When you're
Right.
cutting through the abdominal, like almost like a C-section, you're opening it up, you see everything. It's
Right.
easier to
Right.
perform the surgery.
Yes.
But of course, it's like takes more time to recover,
Right.
more blood loss,
Right.
more recovery time, all those things.
Yes.
And this is like it's easier on the patient. A vagina
Right.
hysterectomy is easier on the patient,
Yes.
but it also takes more skill from the doctor.
Right.
Is that correct?
That's correct.
So for you, you've been doing this as a gynecologist for 15 years,
Yes.
a surgeon for 8 years in this field. You chose something that actually was a little bit more difficult to do
Right.
than the traditional way of abdominal,
Right.
correct?
Yeah.
What was your inspiration? Why did you went this way? Why did you went all the way to Germany to get trained in this
Yes.
field?
When I was in Germany, I trained to be a keyhole surgery.
A keyhole surgeon, okay.
But at that time, one professor in Germany, he did a lot of vaginal hysterectomy.
Okay.
And I was fascinated seeing this kind of operation without abdominal incision at all. And that's, I didn't know before that it can be done that way.
Ah,
So, and I would say it's a surgeon preference and it's surgeon attitude on what you see. And some surgeons may feel, oh, it's difficult and I don't want to do that. But for me, I was so fascinated. And when I came back to Thailand, I started doing so. And the more I did it, the more I like it.
Okay.
And I find it very comfortable doing so.
okay. So
And, but I would say to you, at first it's not easy.
it's not easy. It's probably, I mean, I can try to imagine, I'm not a doctor, but I can probably imagine you're going through the vagina walls.
Right.
You're removing the uterus, removing the fallopian tubes,
Right.
everything through the vagina wall
Right.
with no surgery. I mean, that takes a lot of patience. And there's no cameras or anything.
No
you're
camera.
going right in there and taking that out.
Right.
So it's less invasive for the patients, of course, but
Yes.
of course, most doctors prefer something a little bit more easier.
Right.
Correct?
Right.
It's just like incision, opening it up. But of course, that's opening up for more case of infections,
Right.
blood loss, and
Yes.
also recovery time.
Right.
All right. So
That's correct.
you went all this and been doing this. You've also presented your case in Korea,
Yes.
and you were in that conference. You were probably the first doctor to present your research in doing this. Have
Yes.
you inspired more doctors to be doing this kind
yes,
of like
yes,
vagina
yes. Many
hysterectomy?
doctors from especially Philippines, Singapore, Saudi Arabia, they are very interested, and some of them would like to come over to Thailand to see the surgery.
Okay.
Yes, yes, many gynecologists are interested.
Many guys are interested. Usually, I suppose, younger doctors,
Yes,
I suppose.
yes.
Because if most doctors, from my experience, they're a little bit older, they're set on their ways, they're usually used to
Right.
doing
Traditional way.
which is
Right.
actually a little more invasive.
Right.
Correct?
Yes.
All right. So you've actually promoting this and actually done research in doing this field
Right.
for many years, 8 years
Yes.
of research. You're probably the forerunner in
Yes.
doing this kind of surgery. How has your patients' response been? Because you have done the traditional way.
Yes.
You've gone doing this in vaginal hysterectomy now. What has your patients' outcome been?
They are
Their
very
satisfaction-wise.
satisfied.
Yes.
Yes. I would tell you about a story of one patient. She's an attendant, an air attendant, air hostess, and she's very concerned. She was very concerned of her
Appearance?
appearance,
Right.
cosmetic,
Right.
basically.
Cosmetic.
And she has a very huge uterus, 1,000 gram, for example.
That's very big.
And she came to see me, and I offer her this route of hysterectomy, and she didn't know before. She said, "You can get everything if you can do that." And I know that it was very difficult case, but finally I did it. It took like almost 4 hours.
4 hours.
Yes, it's quite a difficult one. But finally it went well, and she was very, very satisfied. We are still friends over 2 or 3 years.
Yes.
But
So
since then-
there's no scarring,
No
of
scar.
course.
No scar
So
at all.
those who
incision
want to
on
show their
themselves.
bikini line or wear a bikini, there's no scarring involved in this case at all.
But basically, I would tell that cosmetic is not the first concern.
Of course, safety is probably
Safety
the
is the paramount concern,
right.
and invasiveness is the second one.
And from your experience, this is actually the safest way, vagina
Yes,
hysterectomy?
I would say. Yes, in some cases it cannot be done, but with training and with commitment to have it done, with patience, with over 90% of hysterectomy in benign condition can be done this way.
What are the cases that cannot be done?
For example, if uterus is too big,
Okay.
for example, if the biggest uterus that I can perform vaginally is like the uterus of like compared to pregnancy is like 6 months. 6 months is like the uterus is over your umbilicus, which is considered very big.
It's bigger.
Just big. If it's such a like bigger than that, sometimes it's cannot be done. And in some tumor of the uterus that located
Through the
in a
vaginal.
special in the very in the
Opening?
lateral side of the uterus, sometimes it cannot be done.
Because it's blocking
Yes,
the
it's
entrance
blocked.
point.
Right.
Okay.
Right. But overall, less than 10%.
Less than 10%.
Let's say right.
So, as a gynecologist,
Yes.
if you see a patient and you just want to offer this information for most of your patients to understand that this is an option, this is available for
Right.
those who do not want safety concern it's up, probably the top's the best.
Right.
And if the doctor recommended that you can do a abdominal surgery
Yes.
or a keyhole incision or a vagina, if it's safe, you actually recommend a trained doctor
Yes.
should probably be more trained and have this option available for their patient, correct?
Right. Because as you know, evidently and advocated by the most reliable organization in the world, the American Congress of Surgeons and Gynecologists. And the feasibility, the possibility was reported all over the world, especially in Europe and in the United States, in United Kingdom, that most of the case can be performed this way. For example, I would stress to you about is a possibility of removing the uterus through the vagina. Traditionally, if you have a large uterus, a previous cesarean section, prior abdominal surgery, nulliparity. Nulliparity means never give birth before,
Correct.
or if you have to remove the ovary at the time of hysterectomy. All these conditions are considered to be challenging for vaginal hysterectomy. But so many research, and in my practice also, most of these conditions can be done vaginally.
Okay. And
Yes.
in the United States, how many percentage maybe has vagina
Hysterectomy?
hysterectomy has been done?
In the United States, about 22% of hysterectomy are performed vaginally.
Why is it so low?
In my opinion, it's like I told you, it's a
Training?
surgeon's prevalence and surgeon's attitude.
I see.
On that. Some surgeons are not comfortable with vaginal surgery because it's narrow,
takes a lot
it's
of
deep,
training.
it's whatsoever.
Yes, it's narrow, it's deep. It takes
Yeah.
training and patience.
Yeah. In UK, 33%
Okay.
of hysterectomy are done vaginally.
And here in Thailand,
Oh, very few. I
Very
would say
few.
maybe less than 1%.
less than 1%.
Yes.
So if you are in Thailand and you need a hysterectomy
Yes.
and you need to have the best doctor who is trained, you probably should find someone as good as yourself,
Right.
correct, who has experience in many ways of doing surgery for hysterectomy, correct? And also, you would say that this is probably the safest way.
Yes.
Yes?
Yes, this is the safest way, evidently, not by. And as far as in my experience also, it is the safest way. I would, my experience, and also like in the research published.
Hysterectomy is removal of the uterus and the
Yes.
fallopian tubes and
Yes.
the internal of the female body organs, correct?
Right.
Why is this surgery needed or necessary for a female?
Right. The most common indications for hysterectomy is fibroid. Fibroid is a benign tumor of the uterine muscles. This is the most common one. It
This is in
accounts
the
for-
uterus, correct?
Yes, of the
Okay.
uterus. Right. And secondly, endometriosis is the growth of uterine lining outside the uterine cavity.
Ah,
These two diseases comprises, I think, over 80-90% of cases of a hysterectomy, and less than 10% are from cancerous problem.
I see.
Right.
If they do not remove the uterus, the lining, the fallopian tubes, and your doctor recommended, what can be the result of that? Is it complications? Could it be up to death? Or
No. Like fibroid can cause problem, like heavy bleeding,
I see.
pain,
Ah.
and pressure problem. Like a woman may have like more frequent urination, go to toilet more often, and sometimes pain is disabling.
When
And also the endometriosis usually cause pain.
endometriosis, okay, causing pain. When something is removed, is there other side effect that is involved after hysterectomy has been performed?
Basically, no, because the hormones of a woman produces by ovaries, not the uterus. The uterus is just muscles.
Are the ovaries ever removed at all?
No, basically not. But if a patient is over 51 years of age, or she has a history of ovarian cancer in her family, a strong ovarian cancer in her family, we may consider removing the ovaries also at time of
Okay.
hysterectomy.
So when you move, say you have to move the uterus, the ovaries are still there.
Yes,
Those are actually
usually.
promoting the hormones for the female, correct?
Right.
If for whatever reason there is cancer, is something, she's over 51,
Yes.
and the ovaries have to be removed as well.
Yes.
Does she have to be taking kind of hormone replacement?
Yes, in
to-
some cases.
Yes.
Some women experience many disabling symptoms after removing of the ovaries.
Okay.
In that case, she may need the hormonal therapy.
So most of your patients who have gone through this kind of surgery, with
Yes.
your recommendation saying that you have to take this, is their life better after the surgery?
Yes, basically, if they have problem, and that problem usually cause a disabling condition like a chronic pain, heavy bleeding, and yes, sometimes it's quite difficult for them and very how to say it is lower her quality of life.
Her quality of life.
Yes, and
Her sexual life is also, would that be affected as well?
in some cases.
Okay.
Patient may have some kind of painful on
Libido,
sexual
intercourse?
intercourse, yes.
Okay.
With
But
the-
most of the cases, you've actually recommended patients to take out,
Yeah.
doing a hysterectomy
If indicated.
if indicated.
But for example, if you have a fibroid, but you don't have any symptom, you can leave it.
Okay.
If you feel fine, if you are not afraid of anything, it's okay. But usually it's symptomatic uterine tumor.
I see, I
Yeah.
see. So with your recommendations, there are options out there to doing surgeries,
Right.
correct? There is the abdominal,
Yes,
there is the keyhole, I would call them the keyhole incisions,
yes,
and then of course the vagina.
yes.
That is actually not performed very much or very often here in Thailand,
Right.
but you are actually the forerunner, the doctor that has done research and presented her papers overseas as well.
Right.
You're probably the forerunner in advanced surgery in this field.
Right.
You probably want to see more of the surgery being done, this option for other patients as well,
Right.
correct?
Yes.
Okay, so that option is open. I'm very happy and very honored to introduce a doctor who is very cutting edge and introducing a new procedure for a lot of patients out there who need to do surgery in this way. You know, having a hysterectomy is something that is a very personal thing for a female, but there are other options available rather than just do abdominal keyhole. There is vagina hysterectomy. And today we've had a great honor and pleasure to introduce to you a surgeon, a doctor, and gynecologist, Dr. Giti Du Jinda. Thank you very much for your time
It's my
and your
pleasure.
recommendations.
Thank you
โอเค
for
ขอบคุณ
continuing.
มากค่ะ
สวัสดีครับ
Thank you ค่ะสวัสดี
สวัส
ค่ะ
ดีครับ